again, I want to thank everyone that came out today. We have several media outlets. Steve, thank you so much. Bill, thank you so much. Pat, thank you so much. Channel 12, thank you to supporters that are here. Thank you for showing up, and for those that have mobilized with us in this recent movement that we have for the mass vaccination weekend. Thank you so much for coming as well. I also thank my wife and my daughter for being with me here today. And if Juliet runs around, that's just Juliet. So I just want to forewarn you on that. But today's announcement, we're here because I'm running for governor. What I'm hoping to share today is more about why I'm running, who I am, what experiences I've had in life that inform my values, and how those values will influence the way that I govern as compared to the way that others have governed historically in the state of Rhode Island. So for anyone that doesn't know me, my name is Daniel Muñoz. I live in Pawtucket with my wife and daughter. Most of my family's in Pawtucket and Central Falls. My story in Rhode Island started in Central Falls. As a kid growing up, my mother and father separated as a result of my father having substance abuse issues. And so my mother, raising 5 children, had to find a way to both survive and somehow not lose sight of her kids. So as a result, we were really forced to find our own path. And myself and my 4 siblings did that. And that path wasn't easy. It wasn't easy growing up in Central Falls, going through a public school system that was under-resourced, and having very little in the way of mentors and pathways that could lead out of the square mile city. But when I was 17, something changed. Something clicked. I saw a community that was in many ways struggling as a result of inequities that were systemic. And I knew that I had to learn more. And the reason I'm sharing this is there are other inflection points in my development in my life here in the state of Rhode Island where those instances have happened again. And I think we all know that we've had them. As a community, we've had them. So going to Rhode Island College and studying philosophy and finding the words and the ideas and the concepts to know how to change these systems, while it was edifying, it just wasn't enough. Just like it's not enough that time and time again, we have community members, community leaders that are on these steps asking for things to change, but nothing ever changes. We know our history, and we have leaders that don't acknowledge it. We see a path forward, and we have leaders that aren't bold enough to take the path. And so the first step towards taking that path for me was going to medical school, finding the skill sets that I could utilize to address suffering that is in our communities, whether it be physical or mental. But going to medical school was an interesting thing because I then realized that there were very few people that looked like me. Very few people that understood the struggle and the lived experiences of the communities that they were serving. And the consequence of that is that lived experience and the values that manifest from it do not become a part of the working machine, which is the healthcare system, both in America today and here in the state of Rhode Island. And that is just one example that's replicated across all institutions. When I graduated from medical school, it was clear to me that the systems changes that needed to take place could not happen by practicing medicine every single day. It had to happen by engaging health policy, and by understanding the economics and the industry drivers that create either opportunity or barriers to opportunity. In 2018, I ran as an independent. I ran as an independent for Governor of Rhode Island because I did not believe then that the Democratic Party in this state had the political courage to affect progress, real progress, tangible progress, free clinics, investments in low-income housing, expanding affordable housing across municipalities, and actually tackling an antiquated funding formula for our education system. But running as an independent was a barrier in of itself. It forced me to have to defend the values that my lived experience had given me. It forced me to have to defend that I was of the people and for the people. And so while I do not regret running as an independent, because even today, running as a Democrat, I am challenging the establishment. What I was able to understand is that in order for us to move collectively, we need to stop saying that because the Democratic Party is not working for us, we're not going to engage politics. We need to come together and as a people, move the system in a direction that is towards progress. Transform the Democratic Party in Rhode Island in a way that is both inclusive and reflective of the communities that it is serving. There is so much potential that we have as a state. There is so much beauty that manifests every day here in Rhode Island. But are we connecting the dots? Are we connecting the dots? Are we connecting the people? Robert Kennedy once said, progress is a nice word, but change is its motivator. And change has its enemies. We're here today because we know who those enemies of change are. And we're ready to mobilize, to confront them, and to fight for the policy issues, for the initiatives and the programs that will positively impact, that will help, that will support working families, historically disenfranchised communities here in the state of Rhode Island. And we've started the work, and we're going to keep going. And that's why I'm running for governor of Rhode Island, and that's why I'm running in the Democratic Party, and that's the progress that I'm running for. Thank you.
Doctor, last go around when you ran as an independent, you faced many obstacles from institutions, both inside the halls of government and also with media outlets that denied you the opportunity to debate, and even though other independent candidates were allowed to debate. Is that one of the reasons why you're running as a Democrat this time?
Thank you for the question, Bill. And thank you for just acknowledging that that happened. I think too often there's a kind of a disregard, a dismissal of the lack of inclusion in the political system, and we see that across communities of color. At the municipal level, we see it at the state level. Is that the reason that I'm running in the Democratic Party? I'm not running in the Democratic Party to just get on a debate stage. I'm running because it is clear to me that the values in its purest form that the Democratic Party today embodies are not reflected in the leadership that we have. But there's an opportunity to take the candidates that are moving up at the municipal levels, pushing for progress, and to meet them halfway at the state level, to ensure that the programs they're fighting for locally are funded and supported at the state level. Happy to talk about specifics or address questions around that, but that's why, Bill.
What other differences are there this year from last time that you ran? What do you see as being different about this campaign?
You know, last time I ran, just looking back and trying to learn from the experience, what was clear is that sometimes we move with our passion, and we bring that lived experience. And we believe that we are courageous, and in our own right we are, because we are stepping out. But somehow or other, there's a framework around which part of yourself you should show, which facet of your life is going to be enough to be acceptable. And I think in 2018, I somewhat struggled with that.
Okay.
And this time around, I'm starting today by acknowledging my lived experience, by acknowledging how that experience has informed my values. And it's because of the vulnerability that I've been able to accept, to acknowledge that others have come to stand with me. And this campaign is really about that. The community coming together and in solidarity standing for a type of leadership that doesn't just focus on the ends, but on the process to get there. That brings community to the table so that they can inform the decisions that are being made. So that we're not consolidating healthcare systems at the expense of access to healthcare, but instead investing in free clinics and really taking the first steps towards a healthcare system that truly embodies the idea that healthcare is a human right.